We think of nurses taking care of patients, but it's also important they take the time to care for themselves. Working through the COVID-19 pandemic has brought up anxiety, fear, and other strong emotions for many healthcare workers. Sherry Knott is the supervisor of chaplain services at community medical centers. Her team ensures there is spiritual support for all patients, families, and staff, and has worked with the nursing staff to help them manage their mental health.
It's amazing how they can maneuver through difficult situations with patients and take care of them and give them the best of care while they're there in the hospital. We have seen the stress level for them is really high because not only are they caring for their patients, but their own well-being, and then with COVID, their well-being and their families in addition to that. So they have been under a tremendous amount of stress.
Sherry encourages nurses take a moment, even during their shifts, to walk with or talk to a colleague to clear their minds.
First thing is to breathe. Stop and take some breaths. But take time for themselves. Self-care has been the topic of our discussions.
Many nurses also find time outside of work to de-stress from it all. We caught up with two of Community's nurses to find out what they do outside of work that brings them happiness. At every beat of the drum, Marigold Leva feels an extra boost of life. She needs all the energy she can get as the nursing supervisor for the high-risk and postpartum department at Community Regional Medical Center.
So I've been a nurse through Regional Community for almost 20 years now. We've taken care of a high-risk mom that's been in the hospital for a while.
When Marigold isn't taking care of patients, you can find her here at the Polynesian Club of Fresno. She's been doing the hula for about 10 years.
So I come here like once a week, and then once we sweat out, like, oh my God, I feel so good, and then I'm so relaxed again. I'm ready to hit the stress again at hospitals.
Marigold says the COVID-19 pandemic took an emotional toll on her. But she dances off her hard days and finds peace in the Polynesian community and all their beauty. Meanwhile, up in the serene foothills of Squaw Valley, registered nurse Stephanie Ravy trades her scrubs in for jeans and boots.
I raise boar goats, and I have both commercial and registered goats. So some of my goats go for 4-H and FFA student projects.
Stephanie has been breeding goats for 7 years. Now she has about 50 on her property.
Sometimes just watching them, they will roll around on the ground, or they jump and they frolic, and they're just fun to watch, fun to interact with. It's very soothing and relaxing. It brings me a lot of joy.
She finds joy at work too as a nurse navigator at Clovis Community Medical Center. Stephanie helps facilitate patients through their surgical journeys, but the COVID-19 pandemic brought on challenges she never could have imagined.
It was really stressful to see the nurses that I work with every day taking care of sick patients and going into a patient's room, passing their medications, and then coming back the next day and they're not, on that floor anymore.
But these sweet animals have helped Stephanie cope, and she's grateful to have her oasis in the mountains. After the break, we have a lot more on this episode of Medwatch Today. Stay with us.